ورحمة الله وبركاته. زيدون أحمد جواني Medical College, third stage. Today we are going to study parasitology, a very exciting subject in E.histolotica protozoa. Okay, in the name of the God, we start. The E.histolotica presented in three stages: trophozoid stage, cyst stage, and pre-cyst stage, which is not clear in here. Now the trophozoid stage is the stage that causes the disease, and the cyst stage, it is the infective stage, like the stage that would enter and cause the infection to the human. Now the human is the main host of this parasite. It's play a great role in the life cycle of this parasite, as the parasite is a human-to-human transmitted parasite, so its life cycle completed by entering the human digestive system, mainly in the large intestine. Now this parasite transmits from human to human, as I said, from contaminated water or contaminated food, like cold food contaminated with parasite, with the cyst of the parasite. Now it's getting the human, getting multiplication, and then getting out with the feces of the human, and the life cycle will go on and complete again, and contaminated water or food. Now it's the main way to transmit this disease to the food handlers, which are maybe not plain or affected by this parasite. Now this parasite mainly live in the tropical and subtropical area, like we say here, in Brazil, Argentina, India, and this area, Indonesia, yes, like this, Africa. Now, as I say, the contaminated food or water. Now this is a very simple diagram, shows the parasite life cycle. Now the parasite enters the human, which is the main host of this parasite, by the mouth, by contaminated water or contaminated food. Now it enters the digestive system, the stomach. Somebody asked why it is not digested by the acidity of the gastric secretion. Now the answer is the mature cyst is very strength that it's not affected by the acidity of the gastric secretions. Now it's into the small intestine. Now mainly in the small intestine, the parasite will be into a stage which is called the exhaustion, which means the parasite or the trophozoid stage will form from the mature cyst stage. How this happens? The mature cyst stage, the mature cysts contain up to 4 nucleus. These 4 nucleus undergo multiplication, will form 8 trophozoid, and these trophozoid will be multiplicate, okay, it's increase the number in the large intestine. Now this parasite can cause disease or cannot. How that? I will tell you about that. Now if the patient, that depends on the patient or the host nature and acquired resistant to E.histolotica. The virulence of the strain of the E.histolotica and the host physical condition. The amount of parasite that enter the human also can affect this rule. If it is not an invasive, it is in 2 types: invasive and non-invasive parasite or infection. If it is non-invasive, it will cause diarrhea. Simple diarrhea will come to normal after an hour or 2 hours, like this. Now if it is an invasive infection, it will cause pain, abdominal pain, dysentery, diarrhea, nausea, loss of appetite. All these symptoms can be caused by the invasive stage. Now it is many complications of the invasive stage if it's not treated, or the immune system of the body is not so strong. So the first stage of the invasive infection can divide into 2 types. First one is the primary amoebiasis. It's the disease caused by the parasite. The E.histolotica causes amoebiasis. If it is primary amoebiasis, it's only in the large intestine. The secondary amoebiasis in the other organs like liver, lung, brain, all organ of the body, but this main size. The main size is the liver, as it's connected to the large intestine by the portal system, and the other is the lung, as it's so close to the liver, and mainly the right lung. And in the very rare stage, it can cause a brain abscess. Now, if in the large intestine, what will happen to make the invasive stages? There is a normal bacteria found in the large intestine, flora. This will help the E.histolotica trophozoid to penetrate the mucous membrane, like make it digest this hydrolysis of the mucous membrane, and then invade it entire, causes ulcers. Now this ulcers is very special, as it's a flask in shape. The basis in the large intestine wall, and the neck, or what you call it, the open on the narrow lumen, or on the lumen of the large intestine. Now in the further developed or complicated, it's not mainly reach the, it's called to muscularis mucosa and then stop, but in the very rare stages it can penetrate it and into the blood vessels. If it is into the blood vessel, the vein, which is the portal veins, come back to the liver and cause liver abscesses. In a very other rare stages, that will cause an abscess in the lung, the trophozoid, transmitted through the diaphragm to the lung, and cause lung abscesses. Sorry. And in a very rare stage, it will transmit it through the bloodstream to the brain, cause brain abscesses. This is very dangerous. Okay, so like it's not distinguished from cancer very well. Okay, it's not our subject now. Now we will see how the ulcers form in the large intestine. I hope I did not forget anything. Okay, it's all seen in here. Flask shape, parasite, bacteria, help. Okay, this is an ulcer, the beginning of an ulcer, the human host, the human large intestine. This is the invasive of the parasite. As it's it's not going perpendicular. No, it will cause a flask shape, so it will go laterally, or we call it parallel to the long axis of the large intestine. Now we will move to the abscesses. This is the liver abscess. Now liver abscess mainly causes many multiplication, like it will dysfunction of digestion, or pain, abdominal pain. Okay, lung abscesses, and that we can diagnose it by, this is the lung abscesses actually, by an X-ray. It is shown in the X-ray. This is an abscess. Don't forget that the X-ray can show it, as the CT scan here in the liver. The abscess is shown, and this is a brain abscess. So clear here, I think. Yes. Now this is the cyst, which is found in the feces. This is trophozoid stage. See it so clearly. And this is an electron microscope for the histolotica trophozoid. Oh, I forget something. The very important feature of the histolotica is that it can engulf RBCs. You can see it's very clear. Endoplasmic reticulum, the nucleus with karyosome, which is eccentric karyosome. Don't forget that it is eccentric. Now it's treated mainly, the drug of choice is the metronidazole. Thank you for listening. Masalam.